Hi there. Now, I realised I haven't yet explained what ME stands for. ME means myalgic encephalomyelitis. Myalgic meaning muscle pain, encephalo meaning the brain, and myelitis meaning spinal cord inflammation, which has been found during autopsy. ME has been recorded as cause of death on death certificates. ME is often referred to as ME-CFS, CFS meaning chronic fatigue syndrome. However, there is debate about whether that term should be used because the illness is far more than fatigue. ME has also been referred to as systemic exertion intolerance disease, it being a multi-system disorder and one which is worsened by activity. ME affects 17 million people worldwide. It affects men and women, all races and ages, including children. It's the biggest reason for long-term absence from school in the under-16s in the UK. A quarter of sufferers are long-term bedbound or housebound, and many need wheelchairs and carers. It's not contagious, however there does seem to be a genetic disposition because it's not uncommon for several members of one family to be affected. The cause is unknown, but ME is often triggered by infection or a result of extreme physical or mental stress. Sometimes it has a very fast onset, for others it could be very slow. In my case, although I showed ME-type symptoms from a teenager, it was 2 bouts of pneumonia, a jaw infection, and a minor head injury, which resulted in a health collapse, which was eventually diagnosed as ME. At my worst, I could not lift my head off the pillow. I couldn't speak, I had very little movement, and didn't have the strength to swallow. Anyone with ME can deteriorate to this level of illness, and very quickly too. That's why it's vital that it is dealt with very carefully and sensitively. Patients with ME score more poorly on quality of life surveys than patients with multiple sclerosis, stroke, diabetes, renal failure, lung disease, heart failure, and various cancers. ME patients have been found to be more functionally impaired than the end stage of many of these diseases, and they feel effectively the same every day as an AIDS patient feels 2 months before death. The only difference is that the symptoms can go on for decades. It's described as near to an off switch on life as one can imagine. The illest are tube-fed and paralysed and have to live in darkened, silent rooms with virtually no interaction with another person. ME can be fatal, and many sufferers die by suicide because of its unbearable nature. At the moment, there is no test for ME, there is no treatment, and there is no cure. Some people do recover and certainly improve, but usually it takes many years of trial and error. Each case is different and will respond differently to different treatments. There are numerous studies going on, however not nearly enough. Nigel has been involved with a study in Newcastle by Professor Julia Newton. She takes ME very seriously as a neurological illness. I was to be involved but wasn't well enough, and there was no funding for her to visit me at home. More money is spent on hay fever research and male baldness than is spent on ME. There are many symptoms that have been discovered and confirmed through studies such as blood pooling, a higher amount of lactic acid in the muscles, inflammation, a higher number of killer immune cells than average, less oxygen to the brain, along with many more horrendous symptoms. It's thought to be an autoimmune disease, and it's on the increase. There are many questions about ME. It is very poorly understood. Some doctors will insist it's a psychological illness, but the better educated ones will tell you that it's most definitely a severe, debilitating physical disease that needs to be addressed immediately. Well, I hope that's enlightened you a little. Thank you for listening. Bye.